I'm Jennifer, and I'm going to be doing an assessment of your head, your mouth, your ears, your nose, and your neck, okay?
Okay.
I'm going to first start with your skin.
Okay.
And I'm looking at her skin. Her skin is tan in color. It is symmetric on both sides. There's one papule lesion, about 1 millimeter raised, noted. Both arms symmetrically are tan in color. Skin turgor is good. There's no macules noted or any other discolorations or lesions. Can you stick your leg up for me? Tan in color. No varicosities or edema noted on the left leg. Remains tan in color, and again, no edema or varicosities noted on the right leg. Can you stick your hands out for me? I'm going to be looking at your nails.
Okay.
The nails are short and strong. They are round and smooth. And cap refill is less than 3 seconds. And let me see your left leg.
Okay.
Nails, once again, are round and smooth. No rigidity noted. Cap refill is less than 3 seconds. There's no clubbing or contouring noted in either the nails or the toenails. Okay, I'm going to take a look at your hair.
Okay.
The hair is divided evenly throughout the head. The hair is fine and thin. The hair is clean, and there is no signs of infections, lesions, or infestations. There's slight breakage on the ends, but no abnormalities noted. The scalp moves freely. Any pain?
No.
Okay, can you look up at me?
Mhm.
Can you swallow for me? Good. The trachea is midline. There's no distension noted at the neck. I'm going to be testing a few different movements with your jaw, okay?
Okay.
Go ahead and open your jaw for me. And close, open, and close. Good. There's no crepitus or abnormalities with the TMJ. I'm going to be testing your cranial nerve 5. So what I'm going to need you to do is open your jaw, move it around side to side. Good. Close your jaw, push forward, and push against my resistance. Any pain?
Mm-mm.
Okay, good. Next, I'm going to be testing your cranial nerve 7. So we're going to be doing different movements with your face, kind of like facial gymnastics.
Okay.
So I need you to smile. Can you smile with your teeth? Can you close your eyes? Push up with your eyebrows. Keep your eyes closed and lift your eyebrows up. Good. Can you lift against my eyes? Good. Can you look at me and smile? Good. Okay, very good. Next, I'm going to be looking at your eyes.
Okay.
Do you wear glasses?
No.
Okay. Prior to this test, the Snellen's test would have been performed and the Romberg. The Snellen's test would have tested range of motion or eye movement at an eyesight at a distance, and the Romberg would be for nearsighted testing. They both would be performed, one without glasses or corrected lenses and one with. Next, I'm going to be doing a cover test with you.
Okay.
So what I'm going to need you to do is, this is also called a confrontation test. So what I want you to do is cover one eye,
Okay.
and I'm going to cover the opposite,
Okay.
and you're going to tell me when you see the object coming into your sight, okay?
Mhm. I can see it. I see it. I can see it. I see it.
Okay, good. And this would be done to both eyes bilaterally.
Do you want to do the other eye?
No,
Okay.
you're fine.
Okay.
Okay? Next, I'm going to be testing the 6 point of views from your eye.
Okay.
So I need you to cover your eye again.
Same one?
And I'm going to be covering my same eye. And then I want you to tell me when you see the object, okay?
Okay. I see it. 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 I can see it. Even when it's straight out, I can see it.
Okay, good. Okay, you can put your cards down.
Okay.
I'm going to be looking at your eyes. Pupils are equal and reactive to light. The eyebrows are thin but evenly distributed. The eyelashes are symmetric with no alterations or lesions noted. The lacrimal sac is present with no swelling. Any pain when I'm touching your sinuses?
No.
Good. Okay, can you look at me? There is consensual reaction with the papillary muscles. The conjunctiva is white and moist with slight blood vessels noted. There's no hemorrhaging noted in the eye. If I had the ophthalmoscope to do the proper examination, I would be looking into the patient's eye and looking at the lens first. The lens would be intact. I would then be assessing the optic disc of the patient, which would be yellow and round, yellow-orange color and round with distinct margins. It would range from about the 2 o'clock to 5 o'clock, and this would be in both eyes. I would look at the macula and note the white spots. That is the sharpest vision of sight, and that everything is intact in the eye. There's no drainage noted, no swelling around the eyes, no abnormal discharge, and the patient states that she does not wear any glasses. Next, I'm going to be assessing your nose.
Okay.
Any pain?
No.
Okay. If you want to look up for me. Good. The septum is midline. The turbinates are noted. They are red in color. There's moist follicles noted in the nose. Take a deep breath. And a deep breath. Any issues with breathing?
No.
No obstructions noted in the patient. I'm going to test your sense of smell, okay?
Okay.
I'm going to give you 2 things to smell, and I want you to tell me what they are. Can you close your eyes for me? Okay, smell. And another smell?
Yes. That's garlic?
Yes. Okay, good. And the next one?
That's pepper.
Good job. Good job. All right. Next, we're going to be looking in the mouth. The lips are intact. There's no cracking, and they are not chapped. Can you smile for me? Let me see those teeth. Good. Open your mouth. All teeth are present. There's no protruding of the gums over the teeth line. There's no redness or edema noted. Can you open up your mouth again for me? Stick your tongue out. Good. Can you lift it up? And stick it out and down. There's no ulcerations. Is there any pain in your mouth?
No.
No pain, no lesions, no sign of any abnormalities in the mouth. Can you open up your mouth? Stick your tongue out for me. Say ah. The uvula is midline. Any issues with swallowing, gagging?
No.
Okay. No issues noted with swallowing and gagging. Can you open up your mouth for me again? The Sutton's and Wharton's are both present. There's no edema, perforations, or abnormalities with these present in the mouth. Okay. Next, I'm going to look at your neck. Okay. Can you sit upright for me? Good. Can you swallow? Again, the trachea is midline. There's no distension or abnormalities present with swallowing. I am going to assess your cranial nerve 11. So if you want to, can you go ahead and lift your shoulders up for me? Good. And do your head from side to side.
While my shoulders are up?
You can relax them.
Okay.
And side to side. Any pain with this movement?
No.
Okay. I'm going to be looking at your lymph nodes.
Okay.
We're assessing the pre-auricular, the post-auricular, the occipital, the retropharyngeal, the submaxillary, the submental, superficial cervical, deep, and the clavicular. The lymph nodes are barely palpable. They're free moving. There's no distension. Any pain when I'm assessing your lymph nodes?
No.
Good. I'm now going to look at your carotid arteries, which are present. There's a slight pulsation on assessing them, but there's no abnormal distension. I'm going to be listening for a bruit.
Okay.
I will be using the bell of my stethoscope. There's no bruit present on auscultation of the carotid artery. Next, I'm going to be looking at your thyroid gland. If you can just turn the chair a little bit this way for me. Good. This way. Let's turn this a little bit. Yeah.
Okay.
The thyroid gland is not palpable. Go ahead and tilt your head a little bit to the left. Good. I am assessing the right thyroid gland. It is slightly palpable, free moving. There's no abnormalities with that. And turn it to the right. Assessing the left thyroid gland. And once again, it is slightly palpable, free moving, no distension or abnormalities noted with this. Okay, you can look ahead.
Okay.
Did you have any pain during that assessment?
No.
Okay, good. Okay, well, we have completed the head, neck, the mouth, ears, and the throat. Did I look in your ears?
No.
Let's look in your ears real quick. That's one thing we forgot to do. All right. The ears are symmetric. There's no discharge noted. No lesions. Any pain at the mastoid?
No.
Okay. And if I had the otoscope, I would be doing the thorough examination of the ear. I would look into the ear. I would look at the external ear, note a slight amount of cecum, no discharge or lesions noted. I would assess for the optic disc, which would be gray in color. It should be intact with no scarring. Okay, everything looks good. I would also assess for the umbus, which would be present and identifiable. There would be no abnormal lesions with the ear. I would perform 3 tests on you. The first one is the whisper test. So can you cover one ear with your hand and listen to what I'm saying? Can you repeat back what I said?
Soccer ball, beach ball, volleyball.
Very good. And I would do that on both sides bilaterally. Next, I would use a tuning fork to test for the Weber and the Rhines test. The first test I would perform would be the Weber's test, which I would hit the tuning fork, put it midline, and you should hear the noise equally on both sides. And then with the Rhines test, I would hit the tuning fork, place it at the mastoid. You would tell me when you didn't hear anything. And then again, I would hold the tuning fork towards the ear and ask the patient to verbalize when they did not hear anything, again, for this test. And the patient should hear both at the same time, and that would be a normal finding.